I ask patients to avoid significant sun exposure for 4 weeks before and 4 weeks afterwards. So that means
And cold sores are transmitted by kissing someone.
And this is important because certain types of procedures like resurfacing may be appropriate for some or all or none of
my
these.
concern, of course, is always the recovery. In other words, how much recovery time and energy do my patients have?
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hello, this is Dr. Roy Kim, and I'm joined by my wonderful co-host, Dr. Kristy Hamilton, and you're with the beauty scientist. So how are you, Kristy?
Great. Excited about our topic. One of my favorites, skin resurfacing.
Yes. I think generically, there's a lot of confusing terms, and this is not meant to actually be a very in-depth review of every single laser. We're going to get to that in the second podcast episode because that's how big the topic is. But in terms of skin resurfacing, as plastic surgeons, we can actually improve the tightness of skin, but we actually cannot improve the quality of skin. You need something that exfoliates your skin. So we'll be talking about your skin, what to do to prep, all the different technologies, and go from there. So anyway, Kristy, I do think that one thing that we don't talk about enough is, okay, what kind of skin do you have before we start? Fitzpatrick skin classification, dermis, all that good stuff. What do you tell your patients?
So this is a very important concept. So if you Google Fitzpatrick, it'll give you a little questionnaire, and that will help determine what skin tone you are. And it's basically, we're talking about the depth of your skin quality, how active your melanocytes are. So the lightest Fitzpatrick 1, it's going to be those Irish looking people, redheads, very freckly, skin that's so fair that they're almost translucent, really, really light eyes. And then all the way down to like deeper ebony tones, never burns, only tans, and then everything in between. So based on your eye color, your skin color, your propensity to burn or tan, we can classify you. And this is important because certain types of procedures like resurfacing may be appropriate for some or all or none of these categories, depending on what we're talking about. What's the most common Fitzpatrick skin classification patient that you see?
Mainly 2 or 3. And I'm with you. At least in the US, I don't think we see that many people with classification 1, which is the most pale, because essentially if you have an ancestor from Southern Europe or who's Hispanic or you're Asian, you're going to have by default probably number 2 as opposed to number 1. Number 1 implies that all of your ancestors are from Norway or something.
So I always say I was like the ideal candidate for resurfacing of any kind is going to be like a Scandinavian blonde. Like people have got almost no pigment, that they require the least preparation. But the reality is you can significantly increase the number of patients who are candidates for these procedures if you prep their skin. And that's a really, really important concept. It can be the difference between complication, no complication, or just like an okay result and a really, really great result. How do you prepare skin in advance of a more intensive treatment like a resurfacing procedure?
Really, I prefer prescription skincare as opposed to just medical grade skincare, but both can work. What we're both trying to do is we're trying to increase the thickness of the dermis and get your skin ready to heal as quickly as possible. And of course, sort of simple things like avoid the sun, use sunscreen, quit smoking, things of that nature also help to prepare your patients and the skin involved.
I agree. I ask patients to avoid significant sun exposure for 4 weeks before and 4 weeks afterwards. So that means no ski trips, no beach trips. You want to make sure that you are not tan. So you want to be the fairest version of yourself, whatever that may look like. And then I do like putting patients on pigment blockers, melanin production blockers, because I think that just helps avoid any issues with hyperpigmentation after the procedure.
Yeah. And even more common sense things before the procedure would include, hey, let's control acne if you're prone to adult acne. If you have a history of breakouts with herpes or with cold sores, you want to bring that up with the plastic surgeon because we want to suppress it during the procedure.
Yeah. And a lot of people, this is a very common virus out there. Like a lot of people get cold sores. A lot of people have been exposed to the virus and they don't even know it. And maybe they've never had a cold sore before, but after a treatment like this, it might bring it out. And so a lot of us put all significant resurfacing procedure patients on prophylactic or preventative bowel checks or something similar when they're undergoing these procedures.
Yeah. And in terms of sort of the social stigma, you have to understand that we're talking about herpes as a virus. There are a couple of variations, and cold sores are transmitted by kissing someone. So this is like, this could be your grandmother. This could be like when you were a kid. So it doesn't imply anything. A high percentage of American adults have herpes zoster. So this is not something that, you should be ashamed of. If anything, you're in the very minority if you don't actually have it.
Yep, I agree. That's why people are so protective of people kissing their babies, because you can
Yes.
transfer it. So, a grandparent kissing the little baby, and boom, there you go. So a lot of people have the herpes simplex virus, the cold sore type virus, and it's just never been activated. So just because you've never had a cold sore doesn't mean you should skip that medication.
Absolutely. Yeah. And so that's one of the key things before you get into resurfacing. So of course, a topic that you probably love and I love as well. The sexiest resurfacing technology is light. In other words, different types of light, IPL, intense pulse light, or laser. So what are your favorite types of light or laser technologies?
So I love the big gun. Roy, you know that about me. I like the fractionated CO2 laser. I think if we're going to do it, let's do it big. Let's get a great result. So this is a type of ablative laser. Erbium is also ablative, but these are types that actually, when we say ablate the tissue, it actually burns the tissue. And so we're creating little laser channels into the skin and vaporizing the tissue. And that micro injury stimulates collagen induction, helps resurface wrinkles, tone, texture, really turns over the whole surface of the skin with these tiny channels of laser light that creates heat. And so heat will be a common theme of resurfacing, but there's different kinds and different ways that we're going to talk about. But that's my favorite because you can control the depth. You know exactly how many microns every time you're doing a pass. And it's just a very, very powerful, very precise technology. So that's my favorite. What's yours?
That's definitely my favorite. My concern, of course, is always the recovery. In other words, how much recovery time and energy do my patients have after the procedure? Any hints on recovery and, how long you tell patients to expect some redness or pinkness or skin flaking off?
So I have a really powerful laser, and one of the reasons I love it so much is the downtime truly is a week after it. Some of the older technologies for CO2, it can definitely be 2 weeks. And before we had fractionated lasers, it could have been a month. I mean, that's just given the pace of our lives these days, that's a lot to ask for patients to take a month off of work when you're not able to be seen. I think a week can be pretty reasonable. When I do lighter treatments, I will continue to work, and then I see patients and just say, hey, yep, I had a laser. When I did a stronger one more recently while I was on maternity leave, that one I was definitely glad to just be at home and not having to see patients and explain why my face looked the way it did. But now look at it, glowing like the sun. So it's great. You're oozy at first, red. Your skin feels very raw. Around day 3, day 4, it turns into this kind of crust, more like sandpaper feeling. Then all of that starts to fall off. Day 5, you see the light. Day 7, you're looking really good. And then that pink, fresh baby skin, that can persist for a couple weeks, although your skin is intact, it's just very fragile, and then rarely a couple months. So something to be aware of. But you can be wearing tinted sunscreen or a tinted moisturizer after that to mask it.
Yeah, and you said one thing that we both tell our patients. You have to be very, very, very vigilant about sun protection because your skin is so sun sensitive after a laser treatment like this. Any other hints you have in terms of recovery or skin growth right after the big blast? I mean, I tell all the patients about sun protection, which is so vital because your skin is so sun sensitive after the big blast. Is there anything else that you recommend to your patients to sort of expedite skin healing after a laser treatment?
I do. So clinical grade Skincare products afterward is absolute must. So I put patients on specific ones that are geared toward resurfacing recovery. That's really, really important. I also like to have patients increase their protein intake. So similar to after surgery, you have a wound. So granted, these are micro channels, micro wounds, but a wound nonetheless. And so you need more protein to heal that. So I ask patients to eat at least 100 grams of protein a day, maybe more depending on your body dimensions. And that really, really helps as well.
That's all great. I mean, those are the things I recommend as well. So next up is something that's old school, but is now making a comeback. Physical, actual removal or treatment of your skin. So very old school is dermabrasion. I like to call it sandpaper. This is technology that really isn't used much, and it's used to abrade skin. The newer physical treatment, which actually works quite well, is microneedling, where we puncture tiny little holes that are really tiny into your skin physically, and it causes some bleeding. You have tiny little scabs, and those tunnels actually create collagen regrowth. What has been your experience with microneedling or with radiofrequency microneedling?
So microneedling, I think, so interesting to think about the microchannels, right? So in the first topic with the laser, we're talking about heat-created microchannels. Now we're talking about physically, mechanically creating microchannels in the skin. So similar concept. The difference between the laser versus the microneedling is the microneedling is truly a puncture versus the laser beam actually goes in and ablates and takes out a channel of tissue, which is why it's a little bit better at cinching up the skin and conservative tightness than microneedling is. So I like microneedling. I think that's a great treatment. It's a simpler recovery. It's safe for all skin tones. You don't have to worry about hyperpigmentation after microneedling treatment. So it's safe for everybody. And that's always wonderful to have a treatment that's good for the entire Fitzpatrick rainbow. I don't think it's as powerful of a treatment, but that's fine. We have a lot of patients that come in and they're looking more to maintain versus make a big change and turn back the clock 10 years. That's a wonderful treatment with just a couple of days of redness as downtime.
Yeah, I mean, you hit the nail on the head with, honestly, if you're making a physical microchannel, you can use it on any skin color at all. And that's very powerful, especially my patients who have a little darker skin. And with RF, with radio frequency, I do think it hits the equivalency of laser, but the problem is that you need multiple treatments. Whereas one laser blast, hey, you're done. You get a maximal treatment. But the problem, of course, is the recovery versus microneedling or RF microneedling.
Yes, absolutely. Completely agree. And so it's nice to have just options. Also, so many of the things we do, surgery, whatnot, just a big, big outcome, big recovery. It's nice to be able to do something that's a little softer, a little gentler. I was able to do a regular microneedling skin pen when I was pregnant. And that was something I could do to just kind of maintain my skin since I couldn't do many other things during that time.
And one of the other big advantages of microneedling, of course, is the ability to add something else, a little extra onto your skin to drive it in through the microchannels, specifically PRP, exosomes, and other fun-filled factors, which I don't think you can really do easily with lasers only because it's burnt off.
And so it's like a drug delivery system. So I like it for laser too, because I feel like when it's like oozy and the channels are open like that, I feel like it's a great opportunity to get something in. But yes, like the microchannels as a drug delivery system, I love that, whether you're going to add topically something that's going to treat pigment, something that's going to stimulate collagen, like you're saying the PRP or the exosomes, it's going to enhance the outcome and also optimize and expedite healing. What a wonderful combination.
Yes, I think it's great. And then next up, of course, is one of the older methods, which we don't use as much, still effective, chemical peel. So this physically, chemically exfoliates your skin. Some very well-known ones include TCA, that's a chemical, and also phenol, which tends to be more done under monitored situations because it can affect your heart rate. I definitely feel that these are becoming a little less popular. What is your feeling on them?
They are less popular for sure. Definitely the phenol pill. I think to your point, just the potential complication of having cardiac issues is usually enough to make most people say, oh, for beauty, maybe we don't go quite that far. But I think there's been a resurgence of interest in the phenol pill because of TikTok and Instagram. people seeing these like wild transformations. So they can be really dramatic. TCA, I do perform TCA pills. So I like the chemical resurfacing, especially for pigment. So when we were talking about the laser and we were talking about the microneedling, we're talking about these micro channels. Chemical peels are great because they cover the entire surface of the skin. So I think that's a great option, particularly for patients whose number one concern is hyperpigmentation, done correctly, because you can also give people more pigment if you do too deep of a chemical peel.
Yeah. And then to your point, whether it's laser or even physical microneedling, or even if it's chemical, if the power setting is too high, if you leave it on too long, if it's an appropriate amount of chemical, but you just have the wrong skin tone, we don't want to actually deliver burns or bigger wound healing issues. We want to give something to each individual patient, what's appropriate for your skin, how healthy it is. Of course, we want a great result, but also we want to make sure that we're not actually damaging you.
Exactly. And that's why when people were at home during COVID doing these like home chemical peels, there were so many disasters in the ER. So these treatments are definitely, they're highly effective, but it's so easy to take a little bit too far. And that's why it's so important to have them done, to be performed by a professional.
Yeah. And then all of these treatments that we're talking about, really you have to be a doctor or higher. In other words, you can't really buy this off of Amazon. You can't really do this at home in the sense of it's difficult or impossible to get these prescription medications. And even if you can do some of these things, to get the best recovery in terms of skincare, yeah, some of it's actually prescription as well.
Yes, that's absolutely true. And then even if you can find this stuff on the internet, just don't do it. There's a reason why only physicians are administering them. You really can harm yourself. But perform correctly, just the outcomes are spectacular.
Yeah. So final question is, how often do you recommend these treatments, especially for the big blast laser treatments?
That annual, I like to do it twice because, you know me, I'm extra when it comes to the skincare. But I think most people would say annual, no more than twice a year. Microneedling, I think you can do more frequently. People do that monthly. Chemical peels, probably quarterly, and best bookending the summer as opposed to in the middle of it for any of these resurfacing treatments.
Yeah, weather is a concern because you definitely want to be able to heal. And also, if it's darker where you are, like the winter, of course, versus the summer, it's a little easier to protect your skin from the sun.
Yes, absolutely. To be very cautious in Houston, Texas, and California.
Yeah. Well, anyway, thanks so much, Kristy, for joining me and talking to me about this topic. I mean, I think it's a great intro to skin resurfacing, facial resurfacing, and how you can get treatments which really, really help your skin dramatically without surgery. Is there anything else you wanted to talk about or anything else you wanted to let our audience know?
Consistency is key. So many of these we're doing a series of or just maintaining over the years, and you'll really, really see constant, steady improvement in your skin if you do combination treatment and also while integrating clinical grade skincare.
I totally agree. Well, thanks so much for talking about this. And to all the people out there listening, if you have any questions or other topics you want us to talk about, please let us know. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.